Good afternoon. Welcome to the panel on real-world value of blockchain in healthcare. So what does it take to produce real-world value? We asked John, Lucas, Krisa, and Mazin to share with us their experience. And their experience because they are early adopters, they are considered pioneers, and they work around the world, so it's not just a US exercise. The clicker is here. Yeah. So to learn more about pragmatic consideration, interdisciplinary considerations of blockchain in healthcare, you may really want to read this article that we published on BHTY in March 2018. We are 9 fellow members of HIMSS Blockchain Task Force. Thank you, Mari, for orchestrating that effort. I was very happy and privileged to lead that effort. One of the significant elements, in addition to being a HIMSS position paper thought leadership on the subject, is that my fellow co-authors are from Intel, Accenture, Blue Cross, Aetna, and others. So this represents really a microcosm of the ecosystem that really has to work together to collaborate in order to be successful in generating real-world market value of blockchain in healthcare. Numbers speak for themselves. To this date, this article was downloaded over 4,800 times from 70 countries and 16 citations. Right? So if you have not read that, highly recommend that you do, and we will drive this conversation in part based on certain kind of assumption hypothesis that we express as ecosystem statement in this article. My take is that 2017 was the year of the shiny object. Blockchain is a shiny object in healthcare, right? One way to look at that from my standpoint is like it's the ideation expedition. Thought leaders went out to the field, to greenfield or sometimes even whitefield, and tried to figure out what can we do, what should we do with blockchain in healthcare. 2018 turned out to be something that feels like a drag race fanfare. Why is that? Because it was the year of the ICO. If you did blockchain in healthcare and you did not do ICO, you were not considered a very serious player. And too often I came across, interested in your perspectives, came across notions that I felt that my audience, people I'm interacting with, they believe that blockchain and crypto are interchangeable. They have to be one, just two different synonymous words. And that turns into very quickly, I think 2019, as far as I'm concerned, we're still in it, still working on it, evolving into, okay, so let's see what the bottom line is, what reality is, what the real market value of blockchain in healthcare. So, what I've asked the panelists is to look back, and you see in this map represents all the geopolitical areas that the panelists are working on, right? And I've asked them to begin the conversation with 3 questions. So let's reduce the volume a little bit so it won't overpower. Just the background, slight background. I've asked the panelists to share their thoughts about looking back in hindsight, a couple of years back. Are they today where they thought they've gone? If it is yes, why? If it's no, why they are not, or maybe a kind of, right? And with that at the background, hit the bottom line. What their perspectives are for they want to share with investors, entrepreneurs, and enterprise leaders in the private or the public sector, what those individuals should do or should not do, given their experience, in order to be successful in creating real market value, not just academic value, real world market value in blockchain and healthcare. So let's start with 2 of the panelists who will be billed to us, and let's go to the next slide with the videos. We'll start with Mazin. And the video is coming up. 2 of our panelists were stuck on the way in their airport, UAE, yesterday, early in the morning, and Krisa was stuck en route to Boston earlier today. So let's go to the next slide, and let's click on the first video.
Hi, Ron.
And that video will be Mazin. Mazin is yet another pioneer. He's working in
Hi, Ron.
based in UAE.
Here, principal at IQVIA and External Advisor to the Dubai Health Authority. I wanted to actually join the conference today in Boston, but my flight got cancelled, unfortunately, and I've been trying my best to jump on another flight to actually be there on time. Unfortunately, I wasn't able to. My answers to your questions about blockchain in healthcare, are we there yet? From my perspective and the team's perspective, I would say kind of. We are working on spreading awareness and obviously looking at the capabilities that we need and technologies that we need to embed in order for blockchain-enabled solution to scale up in this region in healthcare. We are also part of the reason that we are not there yet is because we're still having mass-produced, solution-enabled blockchain or blockchain-enabled solution in across our health systems. We're still piloting, we're still testing. It's been going on for the last 3 to 4 years. What my advice is simplification of the way we sell blockchain. Rather than focus on the back end and where they store, let's focus on the benefits and just the solution and the technology. And let the physician, the clinicians actually have access to it through EMR companies or through technologies or through case studies. That would be the best.
Thank you,
Hi,
Mazin.
Ron, this is Mazin here.
Let's stop that. To give you perspective, Mazin is based in UAE, heavily involved in setting strategy and implementation of blockchain healthcare in Qatar, in Oman, and in India in a major way. Let's move now to Krisa.
Hi everyone, I'm Krisa McFarland, founder and CEO of Patientory, and I'm very excited to share my blockchain and healthcare journey with you all. So I'll be answering 3 questions similar to our panelists today. The first one, am I where I've envisioned, Patientory would be a couple of years ago? And the answer is yes. Second question, why or why not? I answered yes because starting the company, envisioning the company in 2014, started back in 2015. We knew that it was going to take at least 10 years, especially when you're starting with a new technology and trying to transform healthcare. Question 3, having gained this real-world pioneer experience, what investors, entrepreneurs, and enterprise leaders should or should not do to be successful pursuing blockchain and healthcare going forward? I think, we have to come in with the mindset that this is definitely not an easy feat.
And at that point, she lost connection on this remote Zoom video, so we'll go back to the map slide. We turn down the volume. And how about I'll start with Lucas, and then you'll wrap it up. Let's turn off the volume here. Right. Lucas, are you where you wanted to be?
Kind of, is what I would say.
Kind of, right, right.
In some cases, we're ahead, in other cases, we're behind. Excuse me. For example, in cases we're ahead, from a business development standpoint, we're pretty far ahead right now. We're working with about 1,750 physicians now, and we're actually ahead of some of the competitors in the care coordination BPCI place. Tech-wise, we're on track. We're not ahead, but we're not behind. Doing some work with the NSF on that. For behind, we found general adoption for blockchain to be further behind. The reason for that, there are probably multiple reasons for that, from regulatory use problems to general enterprise business case issues, and also to UI UX, and that would be the one I'd highlight there for the reason I think that's behind. We recently conducted about 30 interviews with customers and users to try to figure out pain points, and that UI and UX is a big pain point for the blockchain healthcare space.
What more specifically in the user experience situation that you guys encountered that you did not factor in to begin with, like blind spots?
We started off thinking people would be probably a bit more ready to adopt decentralized technologies and use things. I don't want to say like they're intended, but keep track of maybe their own wallet, that sort of thing, and they don't really want to do that for the most part, is what we've gathered.
let's tell the audience a little bit what you guys do. Perhaps not everybody knows what the company does in a few sentences. What problem space you try and solve?
Sure. So we're driving to try to bring more trust and value to healthcare. Specifically, right now, we're doing that with kind of two primarily use cases. The first one is care coordination tools, specifically right now through the BPCIA program. And then once people are on our platforms and systems through that, we are helping them monetize their data through a data marketplace.
Thank you. Imagine that we're now in an advisory board meeting. You're advisor to a new company, right?
Yeah.
You have investors, you have the entrepreneurs, and they're preparing for conversation with enterprise clients. What would be your advice to them to do and perhaps something not to do, or do it differently?
So I would advise to focus on the use case first and blockchain second. If you kind of come in to your company deciding you're going to use blockchain without actually identifying a problem, you're probably not going to build the right product. So I would say focus on the use case.
All right. Thank you very much. John, I think that now we can just leave the stage and leave the stage to you. The scope and the scale of your activities. So just in case not everybody really knows what Hash Health is doing, what was the few statement about this, problem space, strategy, solution to go after this, and then those three questions. Are you where you wanted to be?
Yeah. Oh, thank you. So Hash Health is a healthcare innovation firm focused on access and cost of care challenges. We think the biggest challenge, especially in the U.S., is the cost and kind of the irrationality around how healthcare is accessed and paid for. And so, being early in the space, we took a protocol agnostic, use case agnostic approach because there's lots of cost challenges in healthcare. There's supply chain and revenue cycle and identity and all the things that we've been talking about throughout the day today. When we started the company, we very much took the approach of we're going to work on a lot of different use cases with a lot of different partners, not knowing which ones were going to accelerate the quickest, and realizing that it's all about networks, and we weren't sure which networks were going to come together the fastest. And we also realized that the protocols, the technologies, the underlying tools that we would use are going to mature a lot over the years. And so we weren't sure if Ethereum or Corda or any of the stuff, Tendermint, all the stuff that was around back in 2016 when we started the company, we weren't sure which of those were going to be appropriate for those different use cases. And so for the past 3 years, we've kind of had a front row seat in terms of doing a lot of different projects and a lot of different protocols with a lot of different customers in the US and Europe, and around pharma use cases, insurance use cases, care delivery use cases. And so we've kind of seen how the technology's matured, seen how certain use cases fit nicely on top of certain technologies. We've experimented with business models, and we've watched the formation of these networks that are now coming together. And so we're a little different in that regard. Most people are kind of aiming at one thing. We're kind of doing a lot of projects, and our goal is to get a lot of experience and product market fit information back from the marketplace so that we can build the right tools to enable the use of these things. And so we've seen a couple different design patterns emerging. One is around these asset exchange. So a data marketplace is an example of what we call an asset exchange. It's a data market. And then the other one is what we call multi-party business process automation, where counterparties or people in a workflow are using a shared source of truth that in healthcare basically collects and services clinical and business information in order to efficiently manage a contract or a workflow process. And so we've seen these design patterns emerge, and we're starting to get a picture of kind of where the real work is happening and what tooling is necessary to bring that to life. So are we where we thought we would be? I feel like the sort of answer is a cop-out, but I gotta say it because in my world we think of things in these three dimensions in blockchain, right? You think of technical models, you think of innovative business models that are enabled by the use of the technology, and you think about networks. And if you're missing any of that, or if you run into a regulatory issue or something, then the whole thing falls down and you've spent a lot of money and you wasted a lot of time and your customers probably aren't going to come back to you, right? And so, I think from a technical model standpoint, we're where we thought, like there's many more options, technical options to solve problems than there were in 2016. You've seen the spectrum of technologies really evolve. Where in 2016 it was really just Ethereum and Bitcoin that you could anchor to. Now there's a whole spectrum of things that you can anchor to, including a lot of people who are really aiming at the HIPAA compliant space. And there's also these kind of hybrid cloud systems now, where it's basically a serverless architecture with cryptographic security around it. It's not a blockchain. It's not at all a blockchain. It's very much just using cryptography to protect data, but it's a lot less expensive than running a bunch of nodes. And for certain use cases, that's really all you need. But so now you've got, like, it really depends on the business problem, and the business problem directs you to a certain protocol or tooling. If you're truly trying to solve a problem, you need to consider the problem first before you choose the technology to solve the problem. And I think all these protocols, and the last thing on the technical model is, like, now these protocols, there's so many of them, they're starting to commoditize. From a business model standpoint, we've seen the evolution of things like data markets that are innovative in terms of how we solve problems in healthcare. So credentialing is a great example. Professional Credentials Exchange solves the credentialing problem through a data market process where people who have credentials can offer them to people who need them. And so instead of having a bunch of people in your basement who are doing that work over and over, you basically can acquire those verified credentials from someone who's already done that work, curated that data set. And so that is a version of Satoshi's vision of an asset exchange for Bitcoin, except the asset that's being traded on that ledger is a verified credential. And so we've seen, as we hoped we would in 2016, we've seen the maturation of certain business models that are bringing new answers to old problems in healthcare. So, and then the third area is the network piece, right? So are we where we thought we'd be from the network perspective? Yes. I mean, the Professional Credentials Exchange has almost 15 different corporate members, and we're seeing a lot of different alliances coming together to do something that's very new and interesting, which is to come together, even competitive companies coming together to solve common problems that they cannot solve by themselves. And so whether it's ProCredX or the Hun Alliance or the Synaptic Alliance, there are all of these large competitive companies that are realizing that this technology enables them to solve an old problem in a new way by collaborating with people in your network, even if they're competitive organizations. It's the only way you can solve this problem is by using a shared piece of infrastructure. So I think that's why I kind of the kinda answer is fitting, because it's not it's a multi-dimensional answer to a simple question.
Thank you very much. I really appreciate the multidimensionality as we add also the user experience and adoption exercise. Anything, when you look back at the role of crypto in relationship with mining, any thoughts today, like going forward, how should we address the combination of utility tokens, yes or no, or maybe both of you, as well as what's the role of miners today? Yeah. How do we understand miners part of the entire complex? Yeah. Compared to what we saw last time.
I'll start with the miners question. So I kind of view that when you're looking at the miners, you're really just looking at the people running the network. So those would be more akin to, in a cloud perspective, your AWS, I guess. All right. That's kind of how I view their role would continue to be. Miners still need a way to incentivize to actually run the network, but that can vary. In more permission networks, you can have miners or nodes who incentive is more akin to they actually have to use the network versus more public networks where you need some type of crypto usually to reward them to want to continue to utilize their resources to secure your network.
Yeah, I think in terms of, so the definition of mining has evolved a lot since Satoshi, right? And there's some of these derivatives of Satoshi's vision. Some of these DLT and hybrid cloud infrastructures don't have may not even have nodes, much less miners that running a proof of work consensus algorithm on those nodes. And so again, you've got a lot of tools and a lot of different kind of techniques to solve problems now, and there's blockchain and there are these new derivatives. And in terms of tokens, the exciting thing about 2017, and we did not do an ICO, and we're glad we didn't do an ICO. And the reason we did not do an ICO is because we had these large Fortune 500 U.S. and European companies that we were working with. And if you brought up doing an ICO, it was toxic to the conversation. I mean, and they don't work. I mean, the friction, it's like friction as a service. You're introducing friction to something that doesn't need it right now. Now, I will say, the exciting thing about ICOs, the promise of ICOs that was never delivered, was network effects. And having a user of a system have a small piece of ownership and an incentive to see the adoption and growth of that system is a remarkable concept that healthcare has never had before. And so I love that vision because that's true disruption. Mm-hmm. Having millions of consumers who are adopting a healthcare application has the potential to change things dramatically. I just think it's not the right time. 2017 was not the right time. I think that will probably resurface in some fashion, but it's not the work that's going on right now.
And there's no simple answer to that. It's multidimensional.
That's right. That's right.
So there are folks in the room who may be interested in that. Vince, if I may call on you. For example, you hear that conversation if this gentleman were now members on your board and you guys were meeting, would that change anything from what you do already now, you and your team already? And I'm talking about direct trust project. Or this fits what you already figured out? And Uli, I will come to you afterwards. Yeah.
An evolutionary process, and the tact of taking industry consortium and alliance, of course, isn't new here. We've been focused on not recreating infrastructure that already exists. So the deployment of our nodes and those types of things is being done on top of infrastructure that's already deployed and is already high trust compliant.
Yeah.
So one of the questions for you might be, for the deployment, there's a lot of experimentation. Some of our clients are even trying to see if blockchain works or not. It's very early stage in that kind of thing. And when it gets, and there's also some fear, I believe, in hosting their own nodes kind of a service. Are you seeing that in the marketplace? Is it that kind of tentative approach of behavior?
Yeah. Yeah, we certainly are seeing a lot of that, and a lot of use cases fall down because you can't bring the network together, and there's a lot of reasons why the network can't come together. One is you can't get through legal and procurement because you're talking about them doing something that their lawyers are totally uncomfortable with, and bringing a cryptocurrency conversation makes it even worse, right? And so there are options where, like Corda, for example, you're not running Corda, you're running nodes, but they're not global broadcasting. And listen, I'm not pushing Corda, but for certain use cases, that concept of peer-to-peer broadcasting, if the data is super sensitive, it makes sense. And if you've got a network that you're trying to stand up, and that these people are physicians' offices, and they just don't. I mean, like they don't want to run a node, and so you're left with like one or two people running nodes. Then why do you have a blockchain? And so there's just, there's these, oftentimes you've got either technical or non-technical reasons why those conversations don't go well. And as an early stage company, we're trying to find the sweet spot between those different pieces and deploy things that can be deployed. And I think that's what has taken so long, right? It's finding that sweet spot between the architecture and the business model and the network.
Yeah. And I would agree with that. And to expand slightly, one issue we had in addition to that was just a lack of general education, because people don't even know what spinning up a node means. We found that they can think it means a wide variety of things, and all of the news from all the way back in 2017 typically means that's a bad spin. So we also have found we have to spend a lot of time educating people to try to understand like what they're actually trying to do and what their actual use case is, because there's just so much misinformation out there. To give you an idea of the scale of the issue, at one point we had a person we were talking to who asked us to actually show them the blockchain because they thought there was an actual chain of blocks somewhere. So there's still a lot of education in the space that has to happen.
Okay, would you mind introduce yourself? Who you are?
My name is Daniel Hendren. I'm the Chief Growth Officer at NASCO. I used to be the CIO at Conv2x for 10 years prior to that. When the provider topic, I was going to ask the same question, so that's a great point. So when you get down as you move down the scale and you get to those small niche entities that need to have something on the node, so a provider needs to prove that doctor went to a certain school, that doctor was credentialed, all of those attributes that a provider has that isn't part of a hospital network. I know that seems less and less, but there still are plenty. How do you, where is the tipping point where that becomes, because the biggest problem in healthcare, one of the biggest problems that blockchain would solve is the idea that we could solve this provider demographics issue, right? You've heard about it probably 1,000 times, and it's a very good use case, and it's a challenging one, and I know a lot are tackling it. But when I think about it, I just wonder, how do you get to the point where that individual, let's just call them a mom and pop provider, how do you get those folks on a node? When do we reach the point where that's what's feasible?
Yeah. So a little bit, so we're talking about provider identity, and there's basically 3 different approaches to this use case. There's one approach, which is the synaptic approach, which is a data synchronization project. So the blockchain is being used as a data layer where anyone can kind of pay their way and contribute data to a shared, a master data set. And in contributing your data, you learn about how your data is different from everyone else's, and then you go resolve your discrepancies. So that's one. Then you got professional credentials exchange, which is a different business model and a different technical structure. It's a data market, so where people who've gone out and curated that data can offer it for sale to people who need to do that same piece of work, and it's better, faster, cheaper to acquire that from someone who's already got it. That is a different design pattern, a different business model, and a different technical solution that looks like an asset exchange. And then the third area is what we call self-sovereign identity. This is the true blockchain ideal for any kind of identity solution. And it's basically sovereign. Everyone of these companies that basically will allow you to stand up a blockchain where you've got lots and lots of nodes who are all sharing information, and you're selectively exposing that information. And it's the individual that it's self-sovereign. It's the physician who opens and closes the door to that information as they go through their lives, which is a beautiful dream, but it's not really the way the U.S. healthcare works today. So that's an example of something that will probably move faster somewhere outside the U.S., and perhaps with NHS in London. In the U.S., we have a directory problem and a credentialing problem. I lean towards the more practical solutions that don't look like true blockchain, that have elements of centralization, where it's still starting as a B2B solution. And then over time, it has the potential, if the world moves in that direction, it has the potential to go to the consumer, with the physician being the consumer, in which case you would basically layer a wallet application on top of one of those 2 solutions that would expose that physician's information to them and allow them to start controlling it. So from my perspective, having done a lot of different versions of this directory project over the last 3 years on different protocols and using different business models, my perspective is solve today's problem in a B2B space where it's comfortable and you've got a good kind of, it's as simple as possible, and then iterate and expand and kind of build a bridge to that self-sovereign future if we go that direction.
Yeah, I would agree with that, especially on the ideal dream standpoint, but having to focus on the more realistic B2B method right now. I also want to say our approach has also been to try to approach them with at the most basic feature or need we can address and try to work up to that. Trying to get any, especially a mom and pop physician, to try to just immediately jump into not even a self-sovereign identity, but just any of those blockchain solutions will be very difficult. So we've tried to really narrow down individual pain points and kind of like start by bridging that large gap by just targeting one small pain point after the other. In our case, we're specifically targeting care coordination and BPCIA with the hope that we can start there, and then once they get kind of comfortable utilizing blockchain technology and they're on board, we can then start upgrading them and likely end up in that B2B solution. That's kind of also where I see things
And that's the
going.
way a lot of these consortia are working, is they start with kind of something, HUN's a little different. They're kind of a governance first, use case second, but most of the other ones on the list that we're tracking that are kind of real are starting with a very specific use case and trying to solve that problem and then iterating on top of that. So
I would add to that extent on John's point, my team at R&D Ribitzky, our take is all those considerations are critical, but there are means to yet another thing that I think that we heard here before about user experience and adoption. When they come with a situation, this mom and pop shops, we need to figure out what is the total cost of getting there, getting to the play, what will be the total operating cost of continuing display, and how will it impact the economics of this mom and pop shop. And then only then we are ready to have the conversation, recognizing, oh, if they figure out the economics work, now we have players that can deliver that. But the economics is the gatekeeper. And return on adoption. How do we drive adoption over time in order to generate those returns that go beyond the simple return on investment? Yuli, you want to have? All right. Other questions from the forum? All right. Thank you so much for being here. Thank you, guys.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, advancing digital health together. Reaching blockchain in healthcare today and telehealth and medicine today. Special consideration to iWorker Innovations, taking the independent work providing true blockchain transactional interoperability. Special thanks to Seaport World Trade Center for hosting us. We'll be right back after these messages. Don't go away.